Welcome to the Connecticut Health Policy Project's video primers on health advocacy tools. This first video in the series is about the nuts and bolts of effectively advocating within the system. Advocacy is extremely important, a noble and necessary undertaking. Advocacy is bringing the real world to policymaking, ensuring that the rules and the policies that operate our health system are responsive to the needs of real people in the real world, and that they'll actually work the way they're intended. At its best, advocacy provides a reality check for policymakers. Government policies affect much of our lives in ways we may not recognize, in the quality of our air and water, the safety of our food and medical care. Government regulates, licenses, and funds healthcare providers and insurers. If you plan to enter the world of healthcare, you need to get comfortable with advocacy. Let's first deal with the barriers to advocacy. It can be scary. It shouldn't be. Policymakers are your neighbors. They live in the same communities you do. Elected officials rely on your support to keep their jobs. You won't make anyone mad. They expect advocacy input. In fact, they often rely on it, welcome it, and call asking for it. Elected officials in many agencies have identified offices and staff dedicated just to taking your input. You do know enough. In most cases, you will know more about the issue than the policymaker you're talking to. It doesn't have to take a lot of time. It can be as simple as making a phone call or talking to a candidate when they knock on your door. You can do this. There are parts to any advocacy effort. You may not be organizing or running an entire campaign, but it's good to know the parts. Like anything else, break it down. First, define the problem. Be specific, not healthcare in America is broken, but my pregnant clients are having trouble getting specialist appointments. That's far more likely to lead to a constructive solution. Second, find an answer. Make it the answer you want them to implement. If you leave it to them, they may not choose the answer that works. Sometimes the answer is obvious, like more money or making something illegal, but sometimes it's more complicated. Look to other states, other programs, other systems for ideas. Sometimes you have to settle for a baby step. Be realistic. Make your case. Research to be sure you're right, that your solution will work. Create a brief rationale for your solution with references as necessary. Identify the target. Who can make this happen? A person, an agency, an organization. Who has the power to make this happen? Then create a plan and map out the process. Be realistic about what you're going to need to make each step happen, how long it'll take, who will oppose you. It doesn't have to cost money, but money can help. Evaluate as you go. Nothing ever works exactly according to plan. New barriers will arise, as will new opportunities. Adjust as necessary, and then repeat. It's rare for a bill to pass the first year it's proposed. You may have to try again. At its core, advocacy is about education, creating relationships and persuading people. Know who you're trying to connect with, understand their perspective and the pressures they're under. Meet them where they are. Rarely do you get people to do things by arguing with them. For example, if a policymaker really believes that the uninsured are mainly young and irresponsible and just don't want to pay for health insurance, it's not your job to tell them how wrong they are. That rarely works. Instead, explain that coverage is a wise investment for society and keeps people healthy and out of expensive emergency rooms that we all pay for. Values trump facts. Don't overload people with numbers and facts. Stories are key. You're trying to connect with people, not winning an argument. Offer help when you can. And know that the answer will sometimes be no. They can't say yes to everyone. Be understanding and save your energy to come back another time. These aren't just tips. They're more important than that. Always be polite and respectful. Very few people respond well to being treated rudely. Thank people, especially the staff who helped you. Policymakers get thanked all the time, but staff not as much. Rehearse or practice what you're going to say. Have someone else read and edit your letter or fact sheet. Get your story straight. You don't want to be arguing over tactics or numbers with your colleagues in front of a legislator. Never, ever make up an answer. If you don't know the answer to a question, say so, and tell them you'll get back to them. Then do it. Trust your champion or lobbyist. They're professionals. They know what they're doing. You wouldn't second guess your doctor during surgery. Be patient. Policy takes a long time to change, and that's usually a good thing. Things work pretty well. It should be hard to make big changes. And keep your perspective. Everyone's issue is the most important thing to them. Some common mistakes you can avoid. First, learn the system. There are rules. Some are written and some are not written, and they change often. They govern most policymaking. It's not always how you learned it in high school. Learn and respect the culture and the history of the system. You aren't trying to make an advocate out of every policymaker. You just want them to vote yes. If they agree, thank them and walk away. But don't walk away until they've given you an answer. Just because they say they're grateful that you brought this issue to them, that doesn't mean they're going to vote for it. Don't hear what you want to hear what they're saying. You may not get an answer, but don't leave thinking that you did when you didn't. Follow through. This is the most common advocacy mistake. If you said you'd get them something, get it. Once the bill passes, follow through and check to be sure it's implemented and that it fixes the problem. Don't take anything personally and be flexible. If they want to put it in another agency, let them. In addition to the next 3 videos on legislative, budget, and administrative advocacy, our online toolbox has many other useful tools for advocates. Agitators are important. You're entering a noble but sometimes frustrating arena. Don't be scared and don't be put off. There's more help in our Connecticut Health Policy Project Advocacy Toolbox online.